A new study finds Black newborns are more likely to survive childbirth when they are cared for by Black doctors. The study, published in the Proceedings of the National Academy of Sciences, reveals Black babies are 3 times more likely than white babies to die in the hospital when they are being cared for by white doctors. While the research found there is little difference to the survival rate of a white newborn in connection to the race of the doctor. Dr. Jessica Shepard joins me now. She is an OB-GYN at Baylor University Medical Center and women's health expert. Dr. Shepard, welcome. Thank you for being with us. Over the years, we've seen a decline in infant mortality rates across the U.S. However, the disparity between white and Black infant mortality rates has continued to grow. Why is that?
You know, that is a great question, which we continue to try to find the answers for. Now, we do know that this rate is significantly higher when we think of mortality rate in 100,000 deaths per year or live births. We see that that may affect maybe 7 deaths per year, jumping up to 40 when we think of African American females and also infants. So that is strikingly different. Now, we know that the reason has a lot to do with structural racism, and also what we see in organizational healthcare is that we are not having the resources or also the alternative treatments for women. When we think of the reasons why these women die, the top 3 are going to be hemorrhage, pulmonary embolism, and hypertension in pregnancy. Now, these are all preventable deaths when we think of the reason and the causes of why these women are dying. So the question is, why is this still happening in a country such as the United States of America?
So this study, of course, also went on to reveal that the infant mortality gap shrinks when infants are cared for by Black doctors. Did this surprise you? And what does the reason for this seem to be? Why does it seem as though race plays a part in this, medical procedure?
You know, that is something that reigns true in my heart as a Black OB-GYN. One of the things is that representation really does matter. And so when you have these patients who have these paucities, depending on if it's financial, depending on if it's living in a food desert, or the access and resources to get them the adequate care that they need during their prenatal time, sometimes just seeing someone who looks like them, who might understand the difficulties and the struggles that they go through as a pregnant mom, these things do impact prenatal care, and also being able to listen to women when they speak, to listen to women when they have symptoms and when they have difficulties throughout their pregnancy, and how to guide them throughout that and make sure that they're being heard, but also getting the adequate care that they need.
It certainly points to, as you said, the importance of representation. So doctor, how do you suggest that hospitals and doctors address this issue moving forward? Could something like more midwives help, perhaps?
One of the things is that we do need that ability to have extenders of care, specifically when we have women who have, again, high risk pregnancies, being able to make sure that they're getting the care in between visits. And that's why working with midwives would be a great way to extend the care that they can get in between their visits. The other thing that's very important is to make sure that they're getting the actual, whether it's medication, the tests that are needed throughout their pregnancy. But when you think of how many African American or Black doctors that there are in the U.S., they only represent up to 7% of the U.S. Medical rate and statistic. Now, the other thing that also matters is who is making decisions in hospitals, and how do these policies really reign true? And that again goes to representation and making sure that we have representatives that understand the community and can speak for the community, making sure that these decisions from up top are being made that place an impact on these communities to get them the care that they need.
And so, doctor, for Black women who want children but are afraid of the potential risks and hear about studies like these, what advice would you give them?
The advice really remains true through all of this as we go in the future and figure out ways that we can decrease these significant statistics, is to make sure that the discussion is being had with their healthcare providers in maintaining the understanding of some of the comorbidities that they may have during the pregnancy, but also making sure that there is an understanding between all the medications that are needed, all the illnesses that are going through that pregnancy, and making sure that they're getting the adequate care that they need, and making sure from a physician standpoint that patients are being heard, and making sure that that relationship is continuing to grow and that there's no lack of communication.
All right, well, Dr. Jessica Shepard, thank you so much for joining us. We really appreciate your time.
Thank you.